2, 1.
Hey, welcome to another episode of Room 1221 Live. You already know, if you see me on your screen, I'm here to talk about one thing and one thing only: your sexual reproductive health. Today, we are talking about pap smears, cervical cancer, testicular cancer, prostate cancer, what to do to test yourself, make sure that you've got everything checked out. And as always, you know me already, I'm always hanging out with professionals because I'm always bringing you straight facts. So today I'm joined by Dr. Sori and Dr. Dako. Welcome, doctors.
Thank you.
Please
Thank you.
let the people know a little about you.
All right. So my name is Dr. Hannah Sori. I'm a general practitioner and a preventative medicine advocate. So good to be here. I love talking to you guys.
Great to have you here, Dr. Sori.
Thank
Dr.
you.
Dako.
My name is David Darko. I'm a physician assistant, and I'm glad to be here again to once again talk about sexual reproductive health.
Great to have you. Dr. Sori, let's start with you.
All right.
You are the preventative expert, right?
Yes. Advocate.
Yes. How important is it generally to get yourself checked, get tested, first in the reproductive health context and then in the general context?
So in the reproductive health, it's once you are sexually active, especially, it's very good to have some basic testing, at least. I personally recommend yearly testing for people who are sexually active, just because, especially for women, sometimes you may have picked up certain sexually transmitted infections and your symptoms might be vague. You might not know what is going on. And then when we go and test, you'll be like, oh, you actually had this sexually transmitted infection. And ailments like HIV, if you don't test for a long time, right, you may be fine, then one day you are not fine. Yeah. Meanwhile, 10 years back, you actually were infected with the HIV virus. We could have started giving you medications earlier, right, so that you wouldn't progress to AIDS. Mm-hmm. And then you wouldn't have those complications that HIV and AIDS comes with, but you didn't test it. And now we have to deal with the complications of AIDS. So it's good to check, your sexual reproductive health early on, or in fact, as frequently as possible, just so you can prevent dire effects later on. Aside HIV, AIDS, we also have gonorrhea, chlamydia. If you are not checking regularly, you could develop something called a pelvic inflammatory disease, where literally your uterus and then the other reproductive organs get inflamed or infected, and it can end up affecting your fertility. So it's good to get it checked out if you are sexually active. Yeah.
That sounds pretty serious. Now, Dr. Dako, in the context of testicular cancer, prostate cancer, cervical cancer, why is it important to get tested regularly?
Okay, so I think we spoke about this in the last episode where I spoke about what exactly cancer is. Mm-hmm. And I think I spoke about how important it is to know exactly what is going on during that time. Because everything about a cancer is the preventive measures are the most important things. And then knowing exactly what's going on is the most important thing. Mm-hmm. Because it progresses. It progresses from a stage 0 to a stage 5. And sometimes when it gets to a particular point, it exponentially progresses. So knowing exactly what is going on and screening for it, finding it at a point in time, is what is going to be your advantage, right? Yeah. So you always have to make sure that it's good for screenings, because, like she said, you can have picked up the virus 10 years ago, but then you would find out 10 years later. Right, because the symptoms at that time are so minute, you would not know, because it's a progress, it's a development. It starts out very little and it progresses. So the screenings are they go ahead of you to find out exactly what is wrong, right? Because you cannot pick up some of these things. There's no way you might be able to pick up some of these things. So that's how important it is.
Okay, great. Let me stay on that topic for a bit. When would you say is the ideal time for a young person to start making these checks? A young lady, a young guy?
Okay, so for cervical cancer, at the age of 21 upwards, for ladies, yes, 21 upwards.
Wow.
Testicular cancer, those 15 to 35 years. Yeah. Testicular self-exams are great. But then most of the time, there's this stigma where, you feel you feel weird doing that. Finding like you touching your area to find out if there's anything wrong, or going to a professional to touch that area, or like examine that area to find out if there's anything wrong. There's a huge stigma around it, but I think people need to separate those two things and understand that your body is its own system on its own. It needs a type of care and attention. It's not the same thing with your ego. They are two different things. And you need to understand that it's more of an understanding and realization than it is like that stigma that's around there. So males 15 to 35 for testicular cancer, yes. Females cervical cancer 21 years upwards. Usually with prostate cancer, young men don't usually have to worry about prostate cancer because you start to see those symptoms or start to have those risk factors around 40, 50 upwards. That is when you worry about it. Yeah, so it's very, very rare to find someone who would come in with an issue of a prostate enlargement or even like a suspicion of a prostate cancer. It's very, very rare. It's not likely.
Okay. All right. Now, Dr. Sari, getting my lady parts and boy parts checked sounds very invasive, Speedy. It's quite an awkward thing, right? Is it painful? From your experience, from your professional experience and maybe your personal experience, what advice do you have for anyone who's a first timer who's now going to get checked?
Okay, so first of all, we've spoken about, 3 different cancers here. So I'll take them one by one and then we'll discuss what to expect. So we'll start with a pap smear. So a pap smear is basically a test or a procedure where we inadvertently check for the human papillomavirus or check for cervical cancer. And, there's this stigma around that, it's very painful. It's a very hard test. Yada. There's a lot surrounding that. But ideally, a pap smear is not supposed to be painful. It is uncomfortable, yes, because there's something being inserted. But first of all, tell your healthcare provider, you have these fears. Once you are able to communicate with your healthcare provider, list out your fears to them, they will definitely handle it appropriately, all right? A pap smear is a very important test and fear shouldn't curtail you, right?
Yeah.
If you're afraid, speak to the right people. They will help you in the right way. So a pap smear, ideally, when I perform it, not to brag, but nobody has complained of pain. When it was performed on me, it was uncomfortable for me, but it wasn't painful at all. Now, with a testicular examination, most of the time, you can perform it on your own, as in you can do a self-exam. So as he said, men between 15 and 35 years, that's where those are the people more at risk of testicular cancer. So it can be done at home. Once you're done showering, you just look in front of a mirror, look at your balls in front of a mirror. Then you basically want to touch the area. If you feel a painless mass, that is where the worry. If there's pain, we are like, okay, there's pain. Still come to the hospital if you feel like pain in your testicles. But if you feel like a painless mass around your testicles, or your testicles feel very hard to touch, it's a warning sign or an alarm sign. Definitely come and get it checked out. I advise self-examination for testicular cancer. Once you realize in your B signs, as I mentioned, either you have a painless mass or your testicles feel hard, you go to the hospital. And we also spoke about prostate cancer. As he said, men above 40 years. With that, you can't really do a self-examination. You have to come to the hospital. I personally recommend that every man, once your 40th birthday, for Father's Day, get your father it was an appointment to see a doctor so that he can get his first something we call DRE. That's a digital rectal examination. So with that, we put a tiny finger into the rectal area, the anal area, to check the prostate. This finger. It's uncomfortable, a little uncomfortable. We just check the size of the prostate to see whether it has enlarged or to just feel the texture of the prostate. And we also monitor using a a serum test called a prostate-specific antigen as well. So yearly is fine, 2 years is okay, but not more than that to check your prostate.
Okay.
Yeah.
All right. Thank you both. Now this one is to both of you. Our culture is such that already talking about our private parts and sex is quite taboo. Then again, there's all these health nuances, from breast cancer to cervical cancer to testicular to prostate, so many other things, right? How do we navigate these conversations among ourselves and with our healthcare professionals as young people? Let me start with you, Dr. Dako.
I think it starts with normalizing it. Yeah, because it starts from when we are, usually these things start from when we are younger. Like, let's say the conversation of, sex.
Mm-hmm.
We started to have this notion about it when we were younger, and we grew up with it. You can go to certain households and realize that, let's look at the West, for example, like the Americans.
Mm-hmm.
You realize that they are so comfortable with the idea to the point now, it has developed to the point now they call themselves sexual beings. They actually identify as that. And it started from somewhere. It started with the comfort to talk about certain things, and now it has reached the point where it's become too comfortable. Maybe a bit too comfortable. But all I'm trying to say is that it starts from, your upbringing. So I think normalizing it is where it starts from. Like, understanding, first of all, so the onus lies on the adult generation, the older generation, to teach their children younger that, it's not wrong to talk about this. This is what's about. This is what's about. When you start to normalize it, they realize that they don't have any malicious idea towards those things. Yeah. And then it becomes a normal thing, and it affects their whole lifestyle, their habits. Even going for a screening, they realize that, no, this is something I have to do because I understand this, and so they go. Yeah. It becomes part of their routine. It becomes part of them. So yeah, normalizing it is what I would say is the issue. Yeah.
Okay. Thank you, Dr. Sari.
Yeah, I think I agree with him. Ever since we were kids, experiencing sexual feelings has been demonized. Like, if you're developing breast, look at her breast, those honestly, like, you're getting big boobs. All those things have been demonized. So how would you feel confident to even approach a healthcare provider? Mm-hmm. There's something wrong with my breast. Yeah. Help me. Mm-hmm. Yeah. All these things. There's something wrong, like, there's something happened with my testicles. Help me. It's been demonized. But once we're able to reach out to people, tell them that, look, it is normal to have breast, and it is normal to have, testicles and all those reproductive parts. And it is normal to seek help when you don't feel comfortable with those things, or when you feel like there's something amiss. I don't think there'll be much of an issue. So we are now the new generation, right? The Gen Z.
Yes.
So we have to impart it on our kids that, look, you growing up developing these sexual reproductive organs are normal. If you feel like there's any problem, first we have to teach your kids that, look, self-examination is very important. I think you guys spoke about breast cancer earlier, and then self-examination and stuff. Self-examination is important. Teach them how to do it. There are so many resources online. Teach them how to do it. And when they have problems, they can easily come to you. Oh, mommy, I did the self-examination. This is what happened. And then you are able to pick up whatever problems that there is early on.
Yeah. Okay. Yeah. Thank you. My next question is, there are some of us who did not know that sex and sexual health was this deep. For some of us, it's arousal, intercourse, what's it called? Satisfaction, close back on, move on with our lives. But from these conversations, I've realized that there's so much that goes on in our bodies and so much that happens with us in these contexts. What is the overall importance of really understanding what goes on with your body, how these things come up, how these organs work? Let me start with you, Dr. Sari.
Yeah, it's very, well, you just mentioned like progression to you started with somewhere, then ended at satisfaction and putting your clothes. So if you want to be able to, enjoy sex for a long time, right? So we are talking about sexual organs. So your breasts, we are talking about testicles, we are talking about our cervixes. They are all related, sexual reproductive organs in quotes. If you want to be able to enjoy sex for a long time, these organs have to be kept healthy. Mm-hmm. Simple and short. These organs have to be kept healthy. If, you are not doing regular testicular exams between the ages of 15 and 35, if you're at risk of, getting a testicular cancer, and then you happen to get one, which means that gets testicular cancer, which means you are taking away either one or two of your testicles. The production of the male reproductive hormone, testosterone, goes low. Your libido will go low. If you get breast cancer and it's at an advanced stage, and we have to do something called a mastectomy, where we remove the affected breast. In some cases, we do a double mastectomy, where we remove the two breasts. Then how are you able to find pleasure, within the breast area? If you have cervical cancer and it's very extensive because you're not checking, as often as you should, then we have to, do an extensive surgery for that. How are you able to really enjoy sex after that? Yeah. So keeping these organs healthy is very important to prolong your reproductive life, in quotes, and to enjoy it to the maximum.
Thanks, Doc. Back to that.
Okay, so I think what I'd say is that people need to understand that sexual reproductive health is not just about sexual intercourse, but it is health. I think that's the best way I can put it.
It is health.
Yeah, it's health is about making sure everything is at its best, right? So even in as much as these are organs we use for a particular purpose, which is reproduction, they have their own attentions. You need to give them an attention. You need to understand not only is it for this particular purpose, but it's also for this particular purpose. Understand its support system, understand the system that surrounds it. And once you're able to understand these things, you realize that there's more to it than just that, right? You can understand what will cause these issues and how to solve these issues. Yeah. I think people need to now start to see it holistically and to actually stop being ignorant about it. Look beyond it and understand your situation and about your health. Yeah, that's what I'll say.
All right. Thank you, Dr. Daku. Before we wrap up, do you have any final words for our viewers?
Learn more about yourself.
Learn more about yourself.
Learn more about yourself. Learn more about your sexual reproductive health. Understand what it means what sexual reproductive health means as a whole. Mm-hmm. And just read about it, understand it more, normalize it. The more you read about it, the more you start to understand more things. Mm-hmm. The more things start to make sense to you. And now you start to take out the chaff and the weed. We realize that there are a lot of weeds and chaff you take out. And then it makes normalizing such things easier, right? Yeah. That way, it doesn't affect the generation that comes after us because we have a responsibility to take care of that.
True.
I think that's what I'd say.
Sure. Thanks, Doc. Dr. Sorry.
So mine is based on general medicine. We all want to live a long life, and then living a long life would depend on how we take care of our bodies. So as a preventative medicine advocate, take care of your bodies while you're young. Exercise, eat well, go for regular checkups if you need to. And yeah, that's basically my take-home message.
It should be fine.
Yeah.
Okay. Thank you once again, Dr. Daku. Thank you for joining us, Dr. Sori. It's always great. It's always a pleasure to have you on Room 121. We really appreciate your inputs and your advice. And to you, please, if you have any issues, if you're experiencing any symptoms, or please, if you haven't had a pap smear or a breast screening or a testicular exam, if you are below 30, prostate is not really for you, but 30 and above, prostate. If you haven't had any of those, reach us on 1221. We will link you to a Lydia partner clinic, and then you can go and get yourself checked. As always, this has been Room 1221 Live. I am your host, Ivy. I'll catch you on the next episode. Peace.
Room 1221. Room 1221.